a very special webinar in the sense that this webinar does not include only the clinicians, it also include the researchers and the academicians. We have with us Dr. Prangopal Datta sir, does not need any introduction across the globe, and Dr. Mamunal Mehtab Shapnil, who will be as a moderator. So without wasting much time, I would like to hand over the session to Dr. Shapnil.
Thank you, Mr. Shogata. It is my pleasure to welcome you all to this international webinar on the role of povidone, iodine, and gargle and nasal spray in COVID-19. We all know that this is a virus, the SARS-CoV-2, which initially colonizes the upper respiratory tract, and the route of entry is the mouth and the nose. And the disease that we have, COVID-19, the early stage of the disease due to viral infection, and later stage we have more severe symptoms, which is mainly due to the cytokine storm. So if we can do something to help eliminate the virus at the early stages, we can expect that many more patients will not have to go to the hospitals and will be cured with home isolation only. So with this background, we are really honored that we have two very enlightened speakers from India, Professor Dr. Shumita Shankar, head of the Department of Plastic Surgery at the Rangaraya Medical College. And we also have Professor Dr. Vivekanand Kattimani from the Department of Oral and Maxillofacial Surgery, Sibar Institute of Dental Sciences. They are leading a clinical trial in India, which is approved by the Indian Council for Medical Research about the concept that I was just discussing, and we'll be listening to them. We have an expert panel here that comprises of Professor Dr. Shitesh K. Bachar, who's the chairman of the Department of Pharmacy at Faculty of Pharmacy, University of Dhaka. We have a very eminent researcher, Dr. Wasif Ali Khan, scientist, enteric and respiratory infections, ICTDRB Dhaka, who I believe will be heading a clinical trial of this povidone iodine gargle and spray with zinc in COVID-19 for prevention of COVID-19. We have Dr. S.M. Roshan Alam, Assistant Professor, Department of Community Medicine at Rangpur Medical College, Dr. Muhammad Arifur Rahman, Chief Consultant, Holy Dental Care, Sylhet, and Dr. Mirza Muhammad Taibul Islam, Assistant Professor and Head, Department of Plastic Surgery at the Kumilla Medical College and Hospital. To chair this expert panel, we have a very renowned academician, ENT surgeon of Bangladesh. He is my direct teacher and a former Vice Chancellor of the Bangabandhu Sheikh Mujib Medical University, which is the first and the most eminent medical university in Bangladesh. He'll be chairing the expert panel today. So, right to Dr. Muhammad Arifur Rahman, Chief Consultant, Holy Dental Care, State, for his opinion.
Thank you very much, Honorable Chairperson, Professor Prangopal Datta sir, and all the renowned specialists of today's expert panel from home and abroad. Good evening. So basically, in dentistry, povidone iodine is a very old and trusted agent, which we usually use for preoperative mouth rinse. And during this COVID era, this old agent comes into focus, especially due to its effectiveness against SARS-CoV-2. So now we usually use it for patient, and also we doctors are using as mouthwash and also as nasal spray. Basically, it can be effective in 0.5% solution. And Bangladesh Dental Society is provide a guideline for all the dentists from the beginning of this COVID situation. And in that guideline, this povidone iodine is incorporated as a part of PPE, and we are using it before examining any patients, and also we use it as doctors before and after any procedure, because we involved in most of the aerosol generating procedures, which are very dangerous for this SARS-CoV-2 infection. Help of our Bangladesh Dental Society, we create some public awareness build up also for this use of povidone iodine mouthwash and toothbrushing. It's a popular slogan for Bangladesh, as it is viewed by many normal people. I want to share it here. That is 2 minute brush, 30 second mouthwash, coronar সংক্রমণ করবে হ্রাস. So this slogan is distributed by various media from Bangladesh Dental Society, and we are working to create public awareness by using the povidone iodine as mouth gargle and nasal spray. So I want to just take the attention of Professor Pran Gopal Datta sir and all the other specialists so that you, from your expert panel, if we create some awareness about the nasal spray, this could be also helpful for the spread of this disease. Thank you very much.
Thank you, Dr. Arif. I'm sure Pran Gopal Datta sir will discuss this matter, the issue that he have raised when he gives his expert opinion. It is now
you can use applicator tip. That applicator tip can be dipped into the gargle solution, and it can be applied into the front anterior nets and posterior nets completely, so that the mucous membrane will be painted with a betadine and it will stay there only. And we request not to gargle anything and not to eat anything for minimum half an hour. Usually it will be suggested to apply and gargle after the food. So that's how we do the application and gargling. So you can use the buds. Buds can be used for application.
Professor Shapnil, can I add something?
Yes, please.
Yeah, please.
Basically, I've been practicing for last 3 months, so I'm using it, and I have tried various ways. And the best one, I think, the use of a metered nasal spray, and that is basically comfortable. There are lots of nasal sprays available, metered nasal spray like Nozomist in our country that can be open. Yeah, that can be open, and we can mix 19 ml of water and 1 ml of 10% betadine. Then we can just use it as in each nasal, like the regular nasal spray. I found it most convenient and most comfortable in my experience. Okay.
Professor, the issue is that I had COVID, so I have that nasal sticks inserted into my nose. Those are not very comfortable, I think. Getting those introduced into the nose voluntarily 4 times a day would be a bit of a challenge. So, but I would perhaps go for a nasal spray, but hopefully that has to come. Anyway, in the meantime, we have received a question from Professor Dr. Muhammad Ismail Patwari, who wants to know whether the same concentration should be used in nasal sprays versus oral gargle. So the same concentration. Dr. Arif did make a suggestion. What are your suggestions?
Yeah, in the most of the studies, it has shown that 0.5% povidone iodine is effectively destroy COVID-19. So it can be used in 0.5%, both nasally and mouth gargle.
In the meantime, we have Professor Pran Gopal Datta back with us. Without any further delay, it is now my pleasure to once again invite Professor Pran Gopal Datta sir, who is as we have already mentioned, an eminent academician, a leading opinion leader in the field of medical sciences beyond ENT only. He's a former vice chancellor of Bangabandhu Sheikh Mujib Medical University, but the most prestigious introduction for him by me would be that he is my direct teacher. With these brief words, I would like to invite Professor Pran Gopal Datta sir for his opinion as the chairperson of today's session, and I would also request him to please conclude the session after his talk, after his presentation. Thank you, sir.
Okay, so thank you, Shapnil. Thank you very much. First of all, I express my thanks and gratitude to Mudi Mundi Pharma and Mr. Swagoto Ghosh for arranging this webinar. And thanks to the presenter, Mr. Vivekananda Kattimani and Shumita Shankar. They have elaborately presented the role of povidone iodine as a oral gargling or as a nasal spray. But till I don't know whether the nasal spray containing iodine of either 0.5% or 0.27% is available in the market or not. Shapnil, do you know it is available? No. Iodine mixed? No. It is coming.
Okay, sir, not commercially available anywhere in the world. However,
yeah.
we are trying our best
Yeah,
to
yeah,
get it.
yeah. Okay. So actually, if I had to say something as a chair, this is always a privilege because everybody has discussed thoroughly the role of povidone iodine as a bactericidal, as a fungicidal, as effective against protozoa, as also virucidal. But let us go back to the past. During the First World War, there was about 10 million death from the war, that is 1 crore, and 9.7 million death was from the infection. So out of 2 crore, and more than 50% was from post-war infection. Thanks to God and thanks to the science that the antibiotic came in 1928, that is the Alexander Fleming, and then this local medicine, or you can say is an herbal medicine, iodine, came into the market, not as a medicine, but as a local applicant. Still, I remember during our childhood, if we used to have any injury, there would be a tincture iodine paste, or the cotton wool soaked with tincture iodine would used to be placed over the wound, and it would heal spontaneously. And that was tincture iodine. And this iodine, it remembers me that old is always gold. You see, then for thyroid disorder treatment or iodine deficiency goiter, when there was no tablet form medicine, then it was Lugol's iodine solution that used to be prescribed by the ENT specialist and the physician, etc. And possibly many of us still remember then there was a Mendel's pigment. If you have got sore throat, you go to the doctor, he will have a cotton wool with a stick, and with soaked in the Mendel's pigment will rub against your pharyngeal wall, and you have seen that we used to be cured from this. What I want to say, tincture iodine paste, Lugol's iodine, and then Mendel's pigment all had dramatical effect over the infections. Now, during Second World War, the death was 6 crore, and the result of the infection was only 1 crore. 5 crore was from the war field. So now this is the highest time. What I should urge to Moody Mundi, as their parents' company is from Germany, that the oral spray and the nasal spray should be in the market, available for the people as early as possible, because and this nasal spray and oral spray will reduce the prevalence or will reduce the pandemicity to a greater extent. And this is my belief, but I have seen it from my childhood. Now I am about 69 and I have seen it. So this is one request to the Moody Mundi. And what I want to say here, other than the presenter, that is the renowned presenter Kattimuni and Sumita, and everybody has participated here with their utmost knowledge and their experiences, clinical experiences. So this is really a good gesture by Moody Mundi to organize this webinar. And Swapnil, he is one of my colleague in Bangabandhu Sheikh Mujib Medical University. He is always a good monitor for conducting any session, and always I appreciate him. And I think that this session will enlighten a lot of viewers, a lot of spectators throughout the whole world. And I must again and again express my thanks that this povidone iodine, already Mr. Hitesh Bachar explained that that is the glycoprotein and the nascent iodine that penetrates it very quickly, and it is practically, I have seen, and I have already mentioned to you, tincture iodine, Lugol's iodine, Mendel's pigment, etc., etc. So, and we must pick up this old, and we must make it more standardized for this civilization in a more scientific way. And with these few words, if Swapnil, who was conducting this session in a beautiful manner, I must say 100 times more beautiful than that of my deliberation, I thank him for this moderation, and Mr. Shogoto Ghosh from Mudimondi, and Mr. Kattimani and Ms. Sumita. So, thank you from Bangladesh and from the people of Bangladesh that you have participated in this great occasion. Thank you all.